Good morning, everyone, and welcome to our webinar today. We're going to give everyone just a couple more minutes to join in and get settled in, so please stand by. Thank you. Good morning, everyone, and welcome to today's panel discussion, where we're going to learn about the value and innovation of non-traditional benefits. At this time, I'd like to introduce Matthew Herrera, who will be our host and moderator for this panel discussion.
All right, everybody. Brokers and consultants, thank you for joining. It's Matthew Herrera. I'm the head of B2B and broker departments here at Carrington. What a year, right? I think we're all going to look back at 2020 and think, wow, for some of us on this webinar today, this might be your biggest year yet. And for some of us, it might be your worst. We all go through life and experience challenges that can make you feel like you took 10 steps back. It's really pretty easy to do in the profession that we all chose, sales. Whether you want to believe it or not, we all picked this life because we want to be leaders in the company we represent. We are all always open for a challenge, so don't forget what's going to differentiate you from the rest. Honestly, I know time is money, and again, we appreciate everything and all you being on here. I hope this webinar can be used to help you bring value not only to your daily life, but to your client's life as well. We have a great panel for today. I'm really excited for all of you to get an idea of where you might be able to take your clients or your brokerage firms. Honestly, there was a point prior to this year where I personally felt webinars were a thing of the past, unless you were giving away a car or something. But honestly, this year, it's been the new way of collaborating and networking with new folks. So with that, anyone on this webinar that wants to do a virtual happy hour with me to discuss opportunities, the drink's on me. So let's get right to it. Let's go ahead and kick this thing off. The value and innovation of non-traditional benefits. Honestly, when we were drafting this webinar, we wanted to change the way non-traditional benefits were presented to customers. With healthcare always being in the spotlight, it's more important than ever for us to make sure we are fully providing the most comprehensive portfolio to our clients. Insured services are always going to be the shell of what's offered to your customers, but it's time to start making sure the shell is built on a foundation that is filled with benefits that truly bring out the finishing touches. So here's a look at today's panel. Obviously, you got me there on the left, Randy Howell, President of Group Benefit Systems, and Adam Frugoli, Vice President of the Levitt Group. Both of these guys are honestly really good friends of mine. We've been doing business together for quite some time. I thought, out of a lot of the contacts and brokers that I do have, these two guys really have stepped up to the plate this past year and helped provide new solutions for their clients. So can't wait to get to that panel discussion. Here in the beginning, I'm just going to kind of go through some slides to give you guys an idea of who Carrington is, I'll kind of run through that, and then we'll get to the panel, and these guys are really excited to be your panel today. So about us, a lot of you folks know who Carrington is. This is one of the slides I really like to read from, so take a moment. Carrington is an established hub for enhancing benefits with more than 40 years of experience in the non-insured benefit space. From a full range of non-traditional benefits to our full-scale in-house support capabilities, Carrington and our affiliate companies provide an innovative single-source network product and service solution. At Carrington, we believe in today's benefit solutions should be simple and accessible. That's why we make it our mission to enhance the benefits experience for your clients by improving how they take care of your employees. Quick little timeline of Carrington. We were founded in 1979 by two dentists. In 92, we launched our discount fee for service. In 98, we began offering PPO plans and networks for our customers. In 2007, the stage really changed for us with the introduction of telemedicine. We adapted early to the idea of the benefits that the benefits world might become. In 2018, we launched our sister company, DialCare, along with DialCare Mental Wellness in 19. Today, in 2020, the launch of teledentistry has also come to the spotlight for Carrington. Our products and services. Most folks who learn about Carrington are typically shocked to see the amount of products and services we bring to the table. Honestly, being flexible in product choice gives all of you the ability to dive deep with your customers. With dental as our foundation, it allowed us to build up the products and services that complement the ancillary market. With categories that speak to the general public in health, wellness, lifestyle, we have a little bit of everything from telemedicine, mental health, vision, chiro, RX, financial counseling, teledentistry, pet plans, hearing, labs, ID theft, just to name a few. To top it off, we can make these programs your new storefront for your clients. We can guide you in the direction of success with billing services, claims, fulfillment, customer service, and a great compliance department. Yes, I'm on record saying we have an amazing compliance department. If there's something you feel your clients need and we don't have it, let us know and we can figure out a plan to make it work. Let me go back here real quick. Sorry about that. So what are non-traditional benefits? Our affordable non-traditional benefits are non-insurance, membership-based programs that offer access to savings from participating providers. Our non-traditional benefits are affordable, quick to implement, and available throughout the year and to all employees. So some of these names on the right here are kind of some of the areas where you might see different names for our programs and services. Non-traditional plans, non-insured plans, membership plans, access plans, savings plans, fee-for-service plans, discount plans. Our world is kind of evolving, and originally it was discount plans, and all these other names started coming out once we started kind of gaining some steam in this industry. So all these types of names work for us, so feel free to use any of those when you're marketing our services. Virtual health solutions. So, obviously I kind of highlighted this in our timeline. DialCare Physician, again, we really adapted to the telemedicine space early on. We knew that getting into this space that, creating our own solution would be key. And our DialCare Physician program has really taken off. Obviously with the state of the country and everything going on, our physician program really stepped up to the plate and delivered solutions for people in America. And most important, DialCare Mental Wellness, that particular program, whether you want to admit it or not, I think mental wellness is something that's here to stay, and it's an important benefit that your employees and your clients are going to need. Everyone in this world is probably going through something. It really takes someone like us to admit that we might need to talk to somebody about some problems we might be having. And honestly, this program in particular, not only through the employer market, we've really ventured out and brought it to the student and teacher market. We are one of the first programs to introduce student mental wellness to students. We launched that in the state of Texas, and we're very proud of doing that. Students in multiple states now have access to our Dial Care Mental Wellness. They're able to talk to a counselor when they need to. You know, it's one of those things where, just use myself for an example. I lost my brother when I was 17 years old, and I had to do mental health counseling, honestly, twice a week. And quite frankly, I was embarrassed when I had to go into the counselor's office at school. You know, everybody, you know, probably saw me going in there and felt bad for me, but in all honesty, that was saving my life. And I think our mental wellness program in general is going to provide that same solution for a lot of students across the country. So as someone who's very proud to say they believe in mental wellness, I'm one of those folks, and I think this program is going to take off. So please take a look at it and introduce that to your clients. Honestly, one of the coolest products we've got this year is Dial Care Teledentistry. So that just launched for us. Again, another product. We're offering kind of 3 pillars there. We've got physician, mental health, and now teledentistry. A lot of folks say, how in the world can you do a teledentistry consultation? Well, it's pretty simple. A lot of folks, probably 70% of you on this webinar, haven't been to the dentist in the last year. Some of you haven't been to the dentist in the last 3 years. Well, I think the new way of innovation is to probably get a consultation with a dentist. You know, some of us are just scared to go to the dentist. It's flat out that simple. So scheduling a teledentistry visit, offering it to your employees, your clients, you're going to get a lot of folks. You're probably going to drive some usage. It might turn out to be that person may not need, that dentist may say, all right, you know, so-and-so, you may not need to go to the dentist, but I think you need to go in 6 months. Or they may tell you, hey, you know, you haven't been to the dentist in 4 years, your teeth don't look great. I think you need to get into the dentist right away for a cleaning or anything like that. So, you know, this particular program is another that we are super proud of. So please check that out. We'll be able to send you some marketing materials on all these programs. Virtual pet care, I think everyone is familiar with this. It's a program that, you know, also has really taken off here in the last few months. A lot of folks are scared to get out. A lot of folks just really don't want to go see a vet and hopefully not have a high vet bill. Well, there's solutions for that now. You can do a televet visit with your pet. So check that out. It's one of the products, again, that seems to be resonating big time with our employer group. So we'll send you some materials on that as well. On our next slide is one of the programs we're really proud of, Carrington Direct and our Carrington Cares initiatives. I'll start with Carrington Direct. You know, it's a platform to change the way groups under 200 lives can offer our programs to their employees. Honestly, it was created to focus on the small business segment, which we know is the heart of America. I think we have all called on the small businesses with 49 employees, and the owner mentioned, well, they don't offer benefits to their employees, they simply send them to the exchanges. This is exactly where Carrington Direct can change the game. Since launch, honestly, most of the groups that come through are employer paid. We have yet to see a voluntary group come through. That particular stat shows you how needed our products are. So if you have groups under 200, set up a demo with them. I'll gladly help you out with that. You can set up a user account, play around with the services available in the portal. And honestly, from that portal, our dental vision telemedicine has been the go-to. It's one of those programs where if you go to that hair salon or that restaurant or that hotel, you unfortunately have some folks that don't make a lot of money in certain areas, and insurance might be a little bit too expensive for them. So offering benefits like telemedicine, dental, vision, it resonates with that audience very well. And for under $15 a month to employer pay that for their employees, it's a no-brainer. It's offering some sort of product that those folks can have access to and utilize. With our Carrington Cares initiative, it's kind of tailored, kind of segues into that. You know, we've unfortunately, you know, a lot of us have seen or have friends or family that might have been let go or furloughed from their careers. This is a program we created, obviously, for that particular area. If you check out carringtoncares.com, you'll be able to send your clients to this site for direct billing services. We all have clients that have unfortunately had to do this. So make sure you reach out to your clients and ask them what they're providing to those folks. It's important to check on your client and help them deal with some of these unforeseen issues. It's also very important just to lend a hand to your clients. If you're not doing it, somebody else will. Never forget that. So with that, we're going to jump right into the just some highlights of Carrington Direct. Sorry about that. Obviously, this is kind of self-explanatory here. Employer funded. We went from typically more of a 30-day implementation timeline to our Carrington Direct solution is now 48 to 72 hours. So if you have a group that wants to roll through Carrington Direct, as soon as that HR representative or business owner or business manager enrolls that census of employees in our system, they will be getting their fulfillment kits within 48 to 72 hours. So those folks will actually be able to physically use any of the products right away. So those 30, 45-day implementation timeframes for employer groups are a thing of the past. We're moving into the future, and we're excited where that's going. So again, we'd love to do a demo for that particular product once we get to that point. All right, so the real reason you all joined today, we've got the panel discussion. I'm going to ask Adam and Randy to turn on your webcams for me and also unmute yourself. That's pretty important. I'll do the same here. All right. Adam and Randy, are you there?
Yeah, I'm here. How come I don't see myself?
Hold on just 1 second here.
Probably good reason.
Just 1 second, folks. We're getting everybody's webcams going here. All right, guys. Sorry about that. Adam and Randy, are you guys there?
Yeah, I don't know why my camera's not working.
It's okay. Don't worry about it. Randy, you there too, buddy? All right, just 1 second, folks. All right, Adam. While we're getting Randy, he's trying to get in here. So once he gets in, we'll get to that point. So thanks, buddy. We appreciate you joining today.
Hey, my pleasure.
All right. So we'll start with a little bit of a discussion, buddy. If you don't mind, just giving a brief background of who you are, what company you represent, that'd be really helpful.
Sure. I work with the Levitt Group. I want to say we're in about 22, 25 states now. I forget how many we're in now, but we write a little bit over $3.1 billion in premium nationwide. And anyway, I've been in the industry since 2001, so I'm coming up on my 20-year anniversary here. And
Nice.
yeah, that's what happens. 20 years. I had hair, and I had a lot of hair like you, man. And now it you'll get there. You'll get there, buddy.
Yeah.
So I done everything from employee benefits to P&C, and ironically is I'm not even really a P&C. I'm not even really a benefits guy. I'm a P&C guy, and that's what's so easy about Carrington is it's just it's an easy product to sell that even a PNC guy. I work with hospitals and doctors around the country, and I still find a lot of companies that could benefit from these services, and so I think that's kind of unique is that I'm not really even an employee benefits guy. I used to be, but this is such an easy portion to my business that it's seamless.
That's great. Yeah, that's a really good point, honestly. I think we do have a lot of brokers and consultants that are in the PNC world, honestly, and they see our products as a huge value to them. When they're maybe doing that auto, home, or life policy, they see products like ours, and they're great complements to those benefits. So with that, buddy, I'm going to ask you a few questions. Randy,
Okay.
apologies everyone, he's having a little bit of technical difficulties getting in here, but so honestly, Adam, how long have you worked with Carrington, and what products do you offer from Carrington?
Well, I think we've been working together now for almost 9, maybe close to 10 years now. I want to say it might have been 2008 when we started working together. So it's been a while, and the products that we offer is basically is everything. It's just kind of a interesting thing is I think with as many people that are on this webinar, I think that each of us could figure out one unique thing. I know Randy has a pretty unique niche, and working with a set of people, we work with all kinds of individuals, from everything from the large groups down to individuals that are looking for the mom and pa type of operation. So Main Street business is what we typically call it.
Yeah, absolutely. And honestly, what are some of the popular products that you're seeing out there, especially in our space? Is there something that is really resonating more for you with your clients?
Well, there's a lot of them actually, and the thing is there's so many of them, so you kind of have to take things at a bite-size level here. And so, like for example, the dental product I think is probably one of the best dental discount products out in the nation today. And we did a lot of research before we started offering them to our clients, and the ability uh, to shave off the insurance portion of it and just get the discounts, what the network discounts, and have it work seamlessly, and then being able to see exactly what you should be paying before you sign up or before you go to that doctor's office is pretty cool. There's just, I don't think that there's anybody else there that puts their fee schedule online like what you guys do. And the neat thing about it is there's a huge catalog of lots of different options that you can put together. So you can really tailor anything to anyone. So I usually just take that catalog out and it's like, let's pick 5 or 6 of these things and create something for you. Of course, Dial Care has been a huge hit. We've used it. It's I call it the HSA saver, to be honest with you. I mean, there's telemedicine companies out there, but there's telemedicine companies out there that will leave you on hold for hours at a time waiting to see that doctor. And in some cases, a couple years ago, we had to use some of those telemedicine companies that I used, and I remember waiting for someone to see my daughter, and I didn't get a call back until the next day, and they just didn't have enough providers. And the Dial Care product is so nice because it's first of all, they're English speaking. When you call in or you're talking to someone at the customer service center, they're English speaking. Now, granted, they're all from Texas, so they do have an accent, but they're easy to recognize accents. So easy to work with, and those doctors, man, they're pretty amazing, to be honest with you, because I feel like sometimes when I see someone on Dial Care, or my clients see someone on Dial Care, they actually get better service than they would actually walking into the clinic. I feel like that, they're more
Nice.
personable, and they're talking to you more, and they want like the appointments go and they go for a while. Like, they're asking. I mean, I recently had someone call in and ask about some of their vital signs, their testing that they had from their life insurance.
Yeah.
And the guy went through each one of those things with them and spent about 45 minutes on the web on the app with them and went through each one of them. And and at the end of the day, I got a call from the client, and it's one of our big clients. He's like, you know what? I wouldn't have gotten that at my doctor's office. And, we're on an HSA plan. We would have paid $100 for that visit, $125. So, I'm really impressed with the Dial Care. I think that you guys have hit that out of the park.
Yeah, thank you. We appreciate that. Randy, I just unmuted you there. I think I hear you now.
Yep. Sorry, guys. Technical difficulties. So,
Hey, no
Hey,
problem.
Randy.
Hey, no
Hey,
problem, buddy.
hey, Matt.
All right. Hey, buddy, if you don't mind just giving a brief discussion of who you are and introduce yourself to the attendees, we'd really appreciate that, buddy.
Yeah, absolutely. So my name is Randy Howell, and I'm the owner and president of Group Benefit Systems. We are a second generation family owned and operated employee benefits firm. Our focus for almost 43 years now has been traditional benefits. So what you think of when you think of a benefit agency is medical, dental, disability, life, vision. Unlike Adam, who's been in the P&C world, we never got into P&C, retirement, payroll. We strictly stuck to employee benefits. But what we've realized is we've continued to evolve pre-COVID and now more so during COVID, and what it's going to look like after we emerge from this pandemic is the need to think outside the box and need to look for innovative solutions that we haven't typically looked at in the past. And so probably starting 3 years ago, I'd heard of Carrington, hadn't had much interaction with Carrington, and got introduced to Matthew. And anyone who has had the chance to meet Matthew, he's an innovator. He's one of the guys in this industry that is 3 steps ahead of the rest of us. And so that's where the relationship started, was to work with Matt. Matt, you owe me a beer for those comments. But in all seriousness, just working with Matthew and the forethought that Carrington has as an organization has really opened my eyes and my organization's eyes to the non-traditional approach to benefits.
Thank you, Randy. Appreciate that, buddy. And I'll definitely buy you a couple beers because of that. So question for both you guys, we'll start with you, Adam. I feel like a moderator for the presidential debate right now, but Adam, we'll start with you. We'll give you a minute. I'm just kidding. Has Carrington helped you fill any of your benefit gaps? And if so, how?
Well, I think it can fill any gap. I want to say over the last 10 years, we probably our agency's probably made close to $700,000 from Carrington products in commissions, and those are commissions that we probably never have had before. And so that's a big gap to us. I mean, we feel that having that come through each month, and it's a big blessing to us, and it's reliable income, and customers really like it. Customer service is really good. Like, you got a great call center, and it works. I mean, these are products that work. There are no gimmicks about them. They're real products that feel a huge void that we're starting to see in major medical.
Yeah, absolutely. And then just to top on that, Adam, are there any particular benefit challenges, even though you do a lot in the P&C world? We do have some folks on the call today that do a little bit of both. They're mostly employer benefit, but we do have some that dab in the P&C world. So are there any benefit challenges that you're trying to solve for your particular clients?
Well, I think everybody's trying to do more with less, and trying to fill those gaps that with the system that we have in place right now. And absolutely, we have family members, we have clients that are constantly asking about this, and that's what's cool about the Carrington Direct way of going through this. It doesn't take a lot of time to do this. you can get something set up pretty easy, and you're pretty much hands off on it. You're not having to customer service each individual claim. You're not having to work through that. It's already done for you. So it's pretty much done. So all you have to do is go out there and present the solution, and uh, Carrington has the system set up and ready to go to make it work. It's a no-brainer.
Yeah, I agree with that 100%. Thanks, Adam. Your 2 minutes is up, by the way. Randy, how about you, buddy? Has Carrington helped fill the benefit gaps for you, and do you see Carrington helping you fill even more gaps in the future?
Oh, absolutely. I think what's unique about Carrington, and I joked on a call we had last week about their menu of items, is like going to the Cheesecake Factory for a meal. You've got so many things to choose from, and that's a good thing in this situation. Maybe not so much when you go out to eat, but just the product portfolio that they offer is ever changing and provides a suite of solutions that allows you to meet really any type of client that you currently have, or any type of prospect that you want to go after. And the uniqueness to it, and the ability to take a handful of products and bundle them together to create a unique offering in a space that may not or may be underserved. So I think for us, where it's been a benefit is to be able to take what you think of as those kind of that total care, holistic approach to benefits with your dial care platform, with your vision, with your dental, with your financial wellness that you guys have access to. So now all of a sudden, when I'm going out and talking to an employer, a current client, or a prospect, I can say, hey, listen, I know what we're doing for you with medical insurance. We're providing that financial security if you were to have illness or injury. But let's think about the other things that you may not be protecting right now, from your dental, your vision, your telemedicine, to your financial wellness. All of a sudden, you're starting to fill those gaps. And so where we have, it's made us get more creative with our clients, but then also has created more opportunity for us. Organizations that you don't think about having a lot of members, from associations to trade associations, unions. All of a sudden now you've got a platform to talk to them about that you didn't think you'd never have a shot at going after.
Yeah, absolutely. You're exactly right. It's it's a unique blend of programs that we put together, and you're right on the menu there. It's pretty huge, but to your point, it's crucial to bring everything to the table with your clients. Make sure you're not leaving anything off the table, for better lack of terms. But just a few more questions for you guys. This one actually, is a question that I did not send you prior. I'd just like to know where you guys feel telemedicine or telehealth is going in the future. How do you view the program? What does the future hold in your eyes for the telehealth industry? Adam, we'll start with you. Sorry.
Well, I want to make sure that we do this correctly here. I don't want to be that guy that takes too much time here, but I think it's here to stay. I think doctors are more comfortable with it, and patients, consumers are demanding it. I think COVID has certainly pushed that into the forefront, and it's absolutely here to stay. I mean, you guys are doing things with telemedicine that people never really thought was even possible. I mean, you were talking about teledentistry and telemental health. And then, of course, the veterinarian services as well. Those things aren't being done by anybody else. I can guarantee you that. I insure about 400 doctors around the western part of the United States, and they're finally starting to get into telemedicine, not because they wanted to, but because they had to. You guys are light years into that stuff. And that's you're doing things that no one has ever thought about doing before with telemedicine, and I think there's going to be a lot of other things that come with that. And so I think you know, each year it seems like, you know, what was it, 18? You started Dial Care, and from that period of time, it's already came to this, and so it's going to be something that in the next 2 years, I'm excited to see what you, Chuck, and Stuart and Barbara come up with on this.
Absolutely. Thanks, Adam. Randy, what about you, buddy?
Man, just to reiterate what Adam said, telehealth is here to stay. I think you guys were wise in setting up your own platform, because you now can control the narrative around that platform. Gives you the ability to continue to expand that platform. You know, teledentistry, the pet health, all of a sudden you guys can go in, you guys can go into more disciplines with your telehealth platform that aren't necessarily available right now. I think where you guys are head and shoulders above the other telehealth platforms that are out there is you guys have done it in other benefits with your dental and your vision, and you know the customer service experience, you know the onboarding experience, you know what it takes to make those other product platforms and all the admin and compliance that goes around it successful. And I think that by having your telehealth platform your own, you guys have set you set the gold standard for everyone else to follow suit.
Can I just piggyback on one thing that Randy just said too? Really, when you're looking at it, as I've sold the telehealth product, the reporting that you get from Carrington is actually pretty helpful. A lot of clients had no idea how much utilization that they're saving from their healthcare plan to the Dial Care product, and being able to see that and show that on a monthly basis of, hey, this is what your utilization's looking like. By the way, this saved you a bunch of money on you know, co-pays. You know, whoever has a copay anymore, those lucky people, and you know, HSA visits, and ultimately just, you know, the stress on your healthcare plan is a big deal. You don't get that at other places. You don't get that kind of level of service.
Yeah, absolutely. I agree. Couldn't agree more. Honestly, that kind of takes me into my next question, really, of, you know, I know that both of you have wholesale type clients with us. So, you know, as everyone on this attendee list knows, you know, you can either be a broker or consultant, offer our programs on a group retail basis where it's employer paid or voluntary. But you also have an opportunity to build a storefront with Carrington. And Adam and both Randy have both done that with unique clients that they both have, where Carrington is really doing more of a lot of the heavy lifting, really, from the creation of packages and private label fulfillments and private label products and billing, collecting, fulfillment services, compliance services. So if you guys can just talk a little bit about those types of arrangements that you have with us today, I think a lot of folks would like to hear about your experience and what that might look like. So Randy, we'll go ahead and start with you on this one, buddy.
Yeah, so that's the unique thing about Carrington is you have multiple ways that you can approach your relationships, either with the traditional relationships of employer-employee or through an organization, helping them create a package that attracts and retains quality employees or quality members. And so what I found and the unique opportunity I have is it's in the Hispanic community. You, as consultants and brokers, you've got to be thinking of ways to maximize your relationships. And even though you may have a relationship with someone, you don't realize what they do or the reach they have until you really start to understand who they are and what they have. And what I found with this relationship is this gentleman represented an underserved community, underserved within the Hispanic community, and wanted to create value, wanted to bring resource to them that wasn't being addressed from guys like me. And so by partnering with this organization, we were able to create a pretty robust platform that rewarded his members, his team members, for success within their business model. So when you're thinking of it as a broker consultant, look, kind of get out of your comfort zone. Look at the people that you know, see what they do. And if it's not a traditional employer-employee relationship, it may be an association type relationship. It may be a membership type relationship. There's a way to structure some pretty cool things with Carrington that allows you to serve a population that maybe is not being currently served, but then also, to speak to what Adam said, it can create a significant amount of revenue on a recurring monthly basis that once it's up and running. I mean, the way Carrington's team works and the way they help you as a broker, consultant, wholesaler, and then also help the client, you can just sit back and let the money just show up at your doorstep.
Absolutely. And thanks, Randy. I think Randy's particular client is very unique. Just to tie into that, Randy, you know, the Hispanic community in general is something that, you know, that's a market in itself. And we're able to create customized solutions in particular for that market. We have fully bilingual customer service reps within Carrington here at our corporate headquarters. So we go above and beyond for all demographics, really. But you know, thanks, Randy, for your answer there. And Adam, we'll take that to you, buddy. What about you?
Yeah, you know, we have we've been able to go out there and sell this on a white label basis, where, you know, actually they're selling our product for them. So you know, they're selling it to their customers and to their membership. And you know, I echo everything that Randy says. It's a powerful product. They get to customize exactly what it looks like. It looks like their product, but they don't have to go to the legal expense of having to file in all the states and have to have all the lawyers and compliance departments in order to make all this work. You know, they'll even answer the phone, you know, however you want them to answer the phone, and inside that, you know, becomes a pretty powerful relationship. We've had some good luck at, you know, different types of B2B companies or B2C companies that are adding this on as additional benefits or additional ways to reach their customers. We're having luck on it on a sense of with Chamber of Commerce's, it's looking really good on that, as well as for any type of membership, and they want to take this and make an additional amount of revenue themselves. They can do that if it's the right type of client. I just appreciate the ability of having people that know how to do this and have everything in house to make it happen. That makes it happen. You know, I've said this a million times, is whenever we partner with anybody, it's anybody that's in the insurance business knows how difficult it is to acquire a customer, and how much time and how much energy it takes to make that relationship happen. And you know, I can make myself look bad all day long. I don't need anybody's help to do that. And so when I'm bringing in somebody, I want to make sure that they know how hard it is to find these customers and how hard we have to work to keep them. And when you have someone like Carrington working with you, and Matthew and their product team and their customer service people behind that, you don't have to worry about that. You basically work together as a team, and whether it's Rachel or Matthew or a lot of other people that aren't talking today, that, you know, they ask you, you know, how do you want this to work? How do you want the relationship to work? What parts do you want to control? What parts do you want us to control? And we all stay in those lanes here. And so we maintain that we have, you know, we keep servicing the customer in the very best possible way. So tons of different ways to work through this. I would recommend thinking anybody that can sell these products, talk to them about if it's a larger type of opportunity, figure out a way that you can get with Matthew and talk about how you can introduce those products on a white label product where they basically start selling for you.
Absolutely. Absolutely. And I think, you know, a lot of people don't realize that that capability that Carrington has, you know, with the white label component. I think a lot of folks just think we're offering, you know, kind of our shelf template programs to all of our brokers and consultants, and to some of our employer groups as well. But in all honesty, we can take it that much further. And again, like I kind of said before, create that storefront, create a business, and really white label a package for you. So this particular, my next question, I've only got two more. This one's a little off topic, but it's good for you guys. I think it's, we've got quite a few attendees on today, and I think they do a little bit of what you do, obviously, in the insured world. So are there any products that you guys are seeing in your world in the insured space that Carrington might not have? Is there something out there that your clients are asking for, whether that be pet insurance or life insurance or whatnot? I think a lot of folks on the call today would love to hear your opinion on that. Adam, we'll start with you on that particular question.
Yeah, I think pet insurance is a big one. I think as you look at the national trade magazines, Allstate, Nationwide, some large insurance companies are getting into this space. And as you start polling people what they want in their benefit plans, some of our largest companies that I know of that I may not be directly involved in, but our EB brokers are involved in, pet insurance comes up to the top. Another one that we're seeing is financial planning. A lot of millennials are coming out of school with large student loans, and they're looking for different ways on how to pay for those. And different refinance options are another option too. That's kind of what I can think of right off the top of my head.
Absolutely, I agree with that. It's not really even just that. Student loan debt in general is unfortunately out of control. I've got friends that I went to college with forever ago, that are unfortunately still in debt paying college student loans years later. So, finding relief and financial counseling and things like that is a huge plus for kids coming out of college. I think that's incredibly important. Randy, how about you, buddy?
And I think you guys have done a great job of staying ahead of the curve with product offerings. I mean, I think where not so much anything that I'm seeing on the streets, other than just to emphasize what Adam said about the pet insurance and the student loan, it's just taking a holistic approach to that member, especially as the workforce changes, and even more so now that the workforce has changed with COVID on top of it. So if you're thinking about your population within an organization, it's like, what can I provide to those members that is going to just improve the quality of their life? And I think what you guys have got with your telehealth solution with Dial Care, your dental, your vision, your pet insurance, your financial wellness, your student loan forgiveness, that it's really, I think you guys are well positioned. It's just now it's getting that message out through webinars like we're on today to make people more aware that you guys have access to the portfolio of products.
Absolutely. And really in closing, I think it's important to let folks know, we've got some folks on this attendee list that actually aren't partners of Carrington right now. And really we're speaking to you and then our legacy brokers and consultants. The Carrington difference, we feel we really set ourselves apart, of who we are as a company, with the aggregation of benefits, really being innovative and jumping out into the future with our telehealth platforms and our telehealth different programs that we're offering to different groups. And really focusing on, the employee at the employer group, or the member of the wholesale organization, or the member of the union. That's always been our focus. And I think, going into the future, it's important to, gather and get partners like an Adam and a Randy, and build off of each other and bring each other up. There's days where, I've called Adam and, we've kind of not necessarily had it out, but had some constructive criticism type calls where, it's good to have those calls, because if no one's shooting you straight, you don't really have a good partner, in my opinion. If a partner of yours is telling you, that you're doing everything right, then, they may not be paying attention to every little thing. And Adam is a guy who does that for me in particular. And Randy Randy's always a guy that keeps me on my toes. It doesn't matter if it's 6 o'clock in the morning. I assume he's getting done with his CrossFit or something, but he texts me at 6 a.m., kind of my wake up call, letting me know how, what he's going to be doing for the day to help out Carrington, or if it's something that I need just a reminder on. It's important. My whole point of this is it's important to have partners like these guys. So surround yourself with the right people. With that, I'll let Adam and Randy just give a little bit of what you guys see the Carrington differences and what are your top reasons for working with Carrington. That'd be great if you guys could help us close it out. So Adam, we'll start with you on that.
Yeah, well, I appreciate the time, and and I appreciate that you guys aren't thin-skinned. A lot of people don't like to hear. You guys are constantly trying to figure out how you can improve things, and I appreciate that, because that's what I have to do too in my business, is to constantly keep improving. And when feedback happens, you got to be able to listen to that feedback and check your egos at the door. And I think Carrington's really turned into a great partner for Levitt, and we're happy to be introducing you guys to our nationwide brokers. I think Carrington is kind of a unique situation here, because it's such a they have such unique value propositions that you have to really study their products, and you just need to look through the catalog and think of different ways that you can maximize on those opportunities that your competition isn't. And this is a great way of being able to basically create a moat around your client and offer them different products that your competition just isn't able to do, because they're not thinking about this type of stuff. They're thinking about other things. They're thinking about um, the fully insured markets and self-insured and things like this. And these products they just complement all this so much. And I just think that it's an easy way to cement that relationship and make additional revenue and of course help clients. And that's what we're all have signed up to do, is to try to help clients. And of course we need to make revenue, and that feeds our families. And so, I appreciate our relationship with Carrington. I've been out there many times, and this is a product that, I know Randy's in Florida and I live in the state of Idaho. Two different states, two different types of demographics. Idaho has a 1.8 million people that live in the entire place. We have probably a lot more cows than we actually have people running around, but the products work anywhere. And and that's not the case for, some of the competitors that try to compete with Carrington. Their products don't work in other areas. And having that differentiation is big.
Thanks, Adam. Randy, how about you?
My experience with Carrington, what you realize is that you have a true partner when you're working with them. You're just not another agent number. You're not another sales rep that's putting their product in your portfolio. And they'll be the first to admit they're not perfect. They'll make mistakes, but when they do make mistakes, they'll own up to them and they'll work to resolve that issue, not only for your group, but also for future groups, because they don't want to make the same mistake twice. And so that's, I think, what's been reassuring is that Matthew has got the team and the people behind him that make his job a little less challenging. Because a lot of the times when you're dealing with someone in Matthew's position, they'll promise you the world and then there's no way to back it up. But Carrington backs it up. And so I think what's exciting about Carrington as we move, get past this COVID scenario, they're well positioned to help your business grow. They're well positioned to help you bring something of value to your clients that just makes your job and makes your life a little bit easier.
Absolutely.
Hey, just one quick thing here, Matthew, is I like Randy so much because he's so articulate about things, and he makes me think about certain things. Is I don't have to worry about competing against you guys either. That's the other thing, is I don't have to ever worry about competing against Carrington. We have such good relationships that we just don't have that competition that I have to worry about with other companies that I work with. And that's a really nice thing. It's not
Absolutely.
exclusive, but I don't have to worry about you guys going out and marketing to my customers. You allow me to do that.
Absolutely. And we appreciate it. And again, I thank both of you for being on. We got a few more minutes here for questions. If anybody has a question, feel free to type it in the box. I know we're kind of running late on time here. We got about 5 more minutes. And if you have a question after this webinar, obviously feel free to shoot me an email. We'll send you this presentation deck. Actually, it's going to be a more elaborate presentation deck. Probably be about 30 plus slides. So really diving into the different products and services that we do offer. So if no one has any questions, again, feel free to reach out, and we'd love to hear from you. And we really appreciate everyone joining the webinar today. We look forward to doing more in the future. We hope everyone stays safe and happy selling. So thank you all for joining.
Thank you. Hey, take care.
Thanks, everyone.